K. Mangla. I am HOD Moolchand Hospital, HOD in Pulmonary and Sleep Medicine. Today I am going to talk about an important and common subject of pleural effusion. What we understand छाती में पानी या चेस्ट में पानी, इसका मतलब है the water is in the pleura. There are two layers which cover the lung, visceral pleura and the parietal pleura. There is a potential space between these two layers, and if you add water, air, so there is a space there. Whenever a fluid collects into these spaces, it is called pleural effusion. It is a common thing and it has different causes. It can be due to heart, lung, kidney cause, or it can be due to pathologies like TB, cancer, chylothorax, and many different illnesses like collagen vascular illnesses, and many more. The fluid, as and when it collects, one has to find out whether it is a transudate or an exudate. These are the two fluids which are divided on the basis of protein in the fluid. If it is grossly, if it is less than 3 grams per deciliter, it is called transudate, and if it is more than that, it is a exudate. Transudative fluids are due to illnesses of the heart, lung, kidney, and they are usually bilateral on both sides. And otherwise, exudates are due to pathologies, most common of them being tuberculosis. It can be due to cancer, it can be due to collagen vascular illnesses, or it can be a chylothorax. Other fluids that can accumulate in the pleural cavity can be pus, can be due to infection, it can be TB infection or non-TB infection, or it can be due to cancerous things like malignancies of the lung, breast, and thyroid and ovary, and many more. The fluid collects due to the malignancy. So the presentation of transudates is different than the exudates. In the case of transudates, the patient presents with breathlessness, and it depends how fast the fluid has accumulated in the pleural cavity. The patients can be very breathless, or they can gradually, their breathlessness gets worsened. And plus there are symptomatology of the primary illness, whether it is due to heart, liver, or kidney. In the case of exudates, the patients may present again with the breathlessness. They may be toxic in case of it is a pus or due to infection or tuberculosis. They can be toxic, they can be breathless, they may have very high grade fever with chills, chest pain. However, in the case of malignancy, it can be out of the blue presentation. The X-ray is taken for breathlessness and you find that there is a fluid accumulated. Usually there is no fever in these cases. If it is a lymphoma, there can be a fever associated with it. So whenever you come across such a case, if it is a transudate, then you may have symptomatology of the primary organs, that is lung, that is kidney, liver, or heart. But if it is an exudate, then there is again symptomatology of the existing disease. How to go about it? It is normally evident whether it is due to heart, lung, or kidney, because the symptomatology and the presentation of these illnesses is there. It's not very common to tap for this if the fluid, if you obviously know that this is the illness. Otherwise, at times, whenever a patient presents with the pleural effusion, you remove a small quantity of fluid, maybe 20, 50 or 100 ml, and send it for different tests like what are the cells in the fluid, what is the LDH, ADA, what is the sugar, protein, triglycerides, and the cytology. It can be inflammatory like pus-like, or it may show some malignant cells. So it gives a lot of information, and you are able to find out what is the illness. If you are quite sure, if the exudate and predominant lymphocytic fluid with the raised ADA, it is most likely TB. On the basis of these findings alone, you can start them on treatment. While if it is a cancerous condition, then you have to investigate accordingly. In the case of cardiac failure, kidney or liver, you have to treat the primary illness. Most often the fluid drainage is not required unless it is very massive to give symptomatic relief. Otherwise, you treat the primary organ and the transulates get better. Similarly, in the case of exudates, you again treat the primary illness and the TB effusions get better. But whenever in doubt, if you tap a fluid, you find it is not cancerous, it is not fitting into TB, then there is a procedure called medical thoracoscopy. In this case, you take the patient to the OT or the endoscopy suite and make a small hole like put in a chest tube and put the medical thoracoscope inside, visualize the whole pleura, remove the fluid, see the chest wall pleura. If you find any abnormal tissue, take a biopsy, send it for histopathology and different cultures. And you are, in majority of the cases, you are able to reach a diagnosis and you treat these patients accordingly. You can also perform a pleurodesis. That means in the case of cancer, the fluid reaccumulates time and again. It becomes a kind of a nuisance. Patients keep on getting breathless. So if the lung is expanding fully well, you can remove all the fluid and spray some talc or different agents like betadine. You can do a pleurodesis. That means obliterating this potential space so that the fluid doesn't reaccumulate. So my dear friends, again to say pleural effusion is a common condition. Try to find out the etiology or basic cause, treat the cause, remove the fluid, do the testing. Most often you are able to find out what is the cause. If not, go for medical thoracoscopy, take a pleural biopsy, send it for histopathology. Still, occasional case of pleural effusion may still be challenging. It could be non-specific. They should be observed. But most of the cases we are able to reach a diagnosis and treat these patients. Thank you very much. कितना time?
क्यों एंड करना है एंड नहीं किया हो गया शायद